Hello Free State and welcome to Hlasela TV. Today on Hlasela TV we continue with the budget speeches from each department today, specifically the Department of Cooperative Governance and Traditional Affairs, followed by the Department of Health. We look to their MECs to show us their budget and exactly what their plans are for the year 1920. So join us and join them as they Hlasela.
As the Free State Department of Health, our core business is the provision of patient-centered healthcare services that add value to the lives of our people. This budget speech marks a chapter of new hope in the sixth administration, a chapter of new hope in the fight to eradicate unemployment, poverty, and inequality. Together with the people of the Free State, we are ready to write the next chapter in our province's history. The compensation of employees is calculated as CPI plus 1% and additional 1.5% for pay progression and other benefits in 2017 and 2018, and 2018 and 2019 pay progression accruals payments were finalized, which is positive move of the department in its trajectory of moving towards the financial sustainability. We allocated 3.5 million for revenue enhancement to Program 1 administration in 2019-2020 for appointment of case managers. We intend to deploy them in our big hospitals for starters in order to improve on our revenue collection. The expansion of intern cohort, largely for the students returning from the medical training in Cuba, the interns and the registrar absorption will add pressure on the compensation of employees' budget. In total, the department's compensation of employees' budget is proportionally increased across Program 1 to 6 by 24.7 million. In 2019-20, 66.3 million. In 2020-21, it's 92 million. In 2021-22, in order to make up for the shortfall experienced by different programs. On goods and services, the training budget will be increased by 27 million in 2019-20 financial year. The reduction of the budget of goods and services has been avoided, mainly in order to protect the non-negotiable items. On transfers, the medical depot has been allocated earmarked funds for 40 million for each MTF financial year in the next 3 years. The health and welfare SITA payments have been budgeted 21 million in the current financial year, 21 million in 2020-21 and 22.1 million for 2021-22 respectively. On capital, the health facility revitalization grant is reduced from 576 million in 2018-19 to 502 in 2019-20. The budget growth over the past 3 financial years. The budget of the Department of Health increased by 4.4% in 2016-17, 7.9% in 2017-18, and 6% in 2018-19 financial year respectively. The six human milk banks will be promoted and supported, especially in postnatal wards and neonatal intensive care units, as effective approach to reduce early neonatal and postnatal morbidity and mortality for babies who cannot breastfeed. We will intensify efforts to improve the expanded program of immunization and increase immunization coverage to 90% in order to reduce vaccine preventable diseases. The challenge of unavailability of some vital vaccines due to stockouts nationally has been addressed. On HIV/AIDS, our key prevention strategies include male and female condom distribution and male medical circumcision. In current financial year, we shall distribute more than 50 million male condoms and 13 million female condoms, and also perform more than 35,000 male medical circumcisions. At the end of 2018-19 financial year, 273,392 patients were active on antiretroviral treatment. This shows a great improvement from the past 5 years, as more and more people are retained on treatment through adherence clubs and CCMD program. During this year, we are going to initiate more than 30,000 additional patients on treatment. MDR patients are currently being treated at Dr. J.S. Moroka, Kopano, Tukullo, and Pilinomi hospitals. However, there are major infrastructure challenges at Kopano and Welcome that are posing safety risks to both patients and staff. We shall therefore transfer the patients from Kopano to Dr. J.S. Moroka during the course of the second quarter of 2019-20. Additional funding of 2.5 million will be made available for discharged state patients at licensed residential care facilities. The Department of Health will improve the quality of healthcare services through the implementation of ideal health facilities. Currently, 179 out of 222 PHC facilities obtained ideal clinic status in our province. The department will expand the contracting of general practitioners from Thabo Mofokeng, the NHI pilot district, Tulejole-Putswa, Fezile-Dabi, and Karib district. In the effort to implement access to immunization and contraceptives, the department shall enter in agreements with the private healthcare providers, intensify tracing of clients who are lost to follow up by using community healthcare workers and partners. The emergency medical services, 712 million rand was allocated in the 2018-19 financial year. 736 million rand is allocated in 2019-20 financial year. All ambulance services currently operating in Free State have been issued with temporary license, including the private service providers, until October 2019, so that they meet certain requirements. After the inspections, permanent licenses will be issued to those that are compliant. In due course, the department will publish the list of those that are licensed. To date, we have appointed 135 emergency care officers were recruited to increase the number of operational ambulances. The skilling of EMS officers is being upscaled so that we are able to, we have extended the training deadline for the intermediate life support in 2021. A new contract for aeromedical services was signed and started from the 1st of January 2019, stationed at Bethlehem and Bloemfontein. Madam Speaker, the department shall this financial year embark on subjecting the entire EMS drivers to advanced driving skills. More forensic doctors and staff will be recruited to address the turnaround time for postmortems. On Program 4, the provincial hospitals, 1.3 billion rand was allocated in 2018-19 financial year. 1.5 billion rand is allocated for 2019-20 financial year. This allocation depicts 11.6% increase in order to enable our provincial hospitals to procure the necessary specialized equipment and appoint the prerequisite personnel with specialized skills. This program will also concentrate with the help of the University of, we are going to work together with the University Consortium on recruiting the specialists on meeting the basic specialist requirements for our regional hospitals. Medical officers will also be recruited to work together with the specialists. Program 5 Central Hospital, 2.4 billion was allocated in 2018-19 financial year. 2.6 billion is allocated in 2019-20 financial year. Madam Speaker, the issue of security is it's receiving priority. We are working tirelessly around the clock with the security forces to address the security shortcomings in all our hospitals, especially the unfortunate and regrettable incidents that happened at Pilinomi Hospital. The Program 6, that is health science training, 275 was allocated and 341. In 2011, the province took an unpopular decision that was sent South African students out of the country to Cuba. Today, we are proud to say the Free State community is receiving 117 of these medical students as they will start their mandatory medical internship in January 2020. After their internship in 2022, they will be appointed as medical officers in line with what our Honorable Premier announced in SOPA 2019. Furthermore, the department will construct a trauma center in Villiers as announced by the Premier. I hereby table budget vote 5 for the Department of Health for 2019-20 financial year.
Having just stepped out of very progressive budget speeches presented by both MECs, we hoped that all their plans will come together and unpack a world of opportunities and services for our Free State people. With that being said, my name is Vinyana Teka, reporting for Hlasela TV right here at the 4th Road South in Bloemfontein. And don't forget, of course, that Hlasela TV is indeed brought to you by Bombonera Investments in association with the Free State Provincial Government. Otherwise, we'll see you back home.